name is Melody Diaz. Exercise 20 point, exercise 26.1. Complete the table with words from A, C, D, and E opposite. Noun affect, affective. Noun adjective anxious. Noun behavior, adjective behavioral. Noun dementia, adjective demented. Noun disturbance, adjective disturbed. Noun suicide, adjective suicidal. Exercise 25.2. Make word combination using a word from each book. Two words can be used twice. Look at B, C, and D opposite to. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Exercise 25.3. Complete the sentences. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with the gains is called senile dementia. The disorder which is not associated with pathological change is functional. Number 6, an area which forces a patient to repeat unnecessary action is a compulsion. Exercise 25.4. Which symptoms of depression what is patient suffering from? Look at C opposite to help you. Case 41. A 56 years old woman present to her GP complaining of increasing tiredness over the past few months. She had lost interest. Is most thing. She was sleeping poorly and tended to wake up early, but denying any surgical tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. The patient has three of these listed symptoms: tiredness, fatigue, loss of interest, sleeping pool, insomnia. Exercise 26.1. Complete the table with words from A, B, and C opposite. Adjective plain, noun blackness. Adjective continuous, noun continuousness. Adjective deaf, noun deafness. Adjective dizzy, noun dizziness. Adjective numb, noun numbness. Adjective light-headed, noun light-headedness. Adjective unsteady, noun unsteadiness. Exercise 26.2. Make word combination using a word from each book. Look at A, B, and C opposite to help you. Double vision, epileptic fit, predominant symptom, syncopal attack, urinary incontinence, visual acuity. Exercise 26, point 3. A doctor is trained to determine the cause of loss of consciousness. He's a 52-year-old man. Complete the doctor's question, look at C opposite and at the table in 25.26.1 above to help you. Do you lose consciousness? Suddenly or gradually? Did you get warning of the attack? What were you doing before you passes out? Were you worrying or under any strain at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice an involuntary movements while you were unconscious? Exercise 27.1. Complete a table with words from A and B opposite. Noun absence, adjective absent. Noun diminution, adjective diminution. Noun flaccidity, adjective flaccid. Noun spasticity, adjective spastic. Noun washing, adjective washed. Exercise 27.2. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. Number one, it like you to relax. In a, I'm just going to move your arm up and down muscle tone. Two, can I see your hands, muscle bulk, and possibly involuntary movements? Number three, no. Now, in going to straining your arm or try to stop me. Power. Four, can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Exercise 27.3. Complete the sentences. Look at A, B, and C opposite and at the table in 27.1 above to help you. Number one, a flaccid hand drops limply to form a right angle with the wrist. Number two, wrist reflex are reflex that are stronger than normal. Number three, muscle wasting means the muscle is reduced in bulk. Number four, a tick is a front of involuntary movements. Number five, a K is often used to test the Babinski response. Number six, his coordination was poor. His call or performed rapid alternating movements. Number seven, a reflex hammer is used to test reflex. Number eight, when something is diminished, it is less than normal. Exercise 27.4. A patient is brought to A&E in coma. When her, when her name is spoken, she opens her eyes, but she does not answer question or obey instruction. What is her HCC score? HCC 5. Eye opening to speech 3. Verbal response no 1. Motor response no 1. Exercise 28.1. Complete the table with words from A, B, and C opposite and relay forms. Verb cure, nouns cure, adjective curative. Verb exercise, noun excision. Verb grow, noun grown, adjective growing. Verb invade, adjective invasive. Verb obstruct, noun obstruction, adjective obstructive. Verb palliate, noun palliation, adjective palliative. Verb palpate, noun palpation, adjective palpate. Verb spread, noun spread, adjective spraining. Verb swell, noun swelling, adjective swelling, swollen. The exercise 28.2. The notes below are about the patient described in the opposite. Use term output the sentences 1 to 9 in the correct order. To make the next paragraph of the case report, use Appendix 2 on page XX in your need help with the abbreviation. Number 1, examination of the central nervous system was normal, 6. Number 2, his moon and Thor were normal, 3. 3. There was a small first 3 by 4 cm NAS is the right supraclavicular fossa, 7. 4. His cardiovascular and respiratory system were as normal, 2. 6. On abdominal examination, there was a mass palpate 3 cm below the left costal meaning 8. Number 6, on examination, his temperature was 30, 30, 37.8 degrees Celsius. 4. Number 7, there were enlarged lymph nodes in both axillary and inguinal areas. 5. Number 8, his pulse rate was 104 minute, regular, and blood pressure 112/66 1. Complete the exercise 28.3. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, distant spread of tumor cells is known as metastasis. Number 2, many symptoms of cancer, such as difficulty swallowing, are due to obstruction. Number 3, the opposite of painful is painless. Number 4, a malignant neoplasm is called a cancer. Number 5, tumors which do not invade or metastasize are benign. Number 6, secondary tumors are those which result from the spread of a primary. Number 7, if a cure is not possible, palliative treatment should be given. Number 8, a palpable liver suggests metastasis. Exercise 29.1. Complete the sentences. Look at A, B, and C opposite to help you. Number 1, a baby that is born a week before the EDD is premature. 2, a termination pregnancy be necessary for medical reason. Number 3, the first 3 months of pregnancy are known as the first trimester. Number 4, fetal distress is the first stage of labor in an indication for cesarean section. Number 5, it was a breech presentation and delivery was by forceps. Number 6, a miscarriage mother term for a spontaneous abortion. Number 7, the cord was wound tightly around the baby's neck and it was unfortunately stillborn. Number exercise 29.2. Complete the table with words from a opposite. Verb about, noun abortion. Verb abort, noun abortion. Verb deliver, noun delivery. Verb induce, noun induction. Verb miscarry, noun miscarriage. Verb present, noun presentation. Verb terminate, noun termination. Exercise 29.3. Dr. Bennett and SHO is presenting a patient at a weekly meeting into obstetric unit of a hospital. Complete the presentation with the correct form of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she has pregnancy with she was 19, with, which was terminated, and another one a year later, with spontaneously aborted. Science then she has had 3 pregnancies. At the first, the baby was delivered normally at 40 weeks. In the second, she has an induction of labor at 39 weeks because of fetal distress. The third baby present a breath and was delivered by cesarean section. Exercise 30.1. Make word combination using word from each book. Look at A and B opposite to help you. Blood staining, bread sounds, plural rub, productive co, vocal resonance. Exercise 30.2. Rewrite the question using words that are better known to patients. Look at A opposite to help you. 1. Is your cough productive? Do you cough up any frank? It is a loose cough. Number 2. What color is this sputum? What color is the plague? Number 3. Is it ever purulent? Is it ever yellow? Number 4. Have you ever had hemoptysis? Have you not noticed any blood in it? Number 5. Do you suffer from dysphoria? Any problems with your breathing? Exercise 30.3. Are you following statements true or false? Give reasons for your answers. Using your medical knowledge and A and B opposite to help you. Number 1, a patient who has a loose cold produce friend true. Number 2, crackles are heard when the airways are narrate, false. A patient who has a non-productive cold produce sputum, false. Number 4, vessels are typical of pleurisy, false. 5, a pleural roof is a sign of asthma, false. Exercise 31.1. Complete a description of Herb's zoster shingles by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Shingles. Herb zoster usually starts with pain and soreness that red. Number spots, muscles appear then develop into groups of 3 small blisters, vesicles, over a particular area on one side of the body. In most patients, new blisters, lesions continue to appear to 3 to 5 days. 2, 5 small blister vesicles become filled with pus, pustular and 10 form scabs. Cruz. In severe case, there may be scars, cicatrices afterwards. Read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spores are scattered pink muscles with a purse first behind the ears and on the forehead. The rash spreads rapidly, first to the trunk and then to the limbs. Location and distribution. First behind the ears and on the forehead, the trunk and limbs. Grouping, scattered. Type of lesion, maculas. Color pink. Exercise 31.3. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and abdomen. Grouping scattered. Type of lesion, small macules with some scars. Color pink, luteate psoriasis. Exercise 30, 31.4. Complete the notes for the lesion in the foregraph and searches a diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral angle of the leg eye. Grouping single. Type of lesion, nodule. Color, white, pink, basal cells carcinoma. Exercise 32.1. Write the corresponding medical terms from the ordinary English word and say what kind of force involvement. Look at A opposite to help you. Common word, brush. Medical term, contusion, hematoma. Type of force, blunt. Common word, cut. Medical term, incision wound. Type of force, sharp. Common word, grace. Medical term, abrasion. Type of force, blunt. Common word, star. Medical term, linear ablation. Time of force, blunt. Common word, stab wound. Medical term, penetrating. 1. Type of force sharp. Common word thread. Medical term, laceration. Type of force blunt. Exercise 32.2. Choose the correct word to complete a description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grasses, scratches, grasses above. The left eyebrow and on the left side of the neck of construction to the left side of the lower lip and tears to the left cheek. Exercise 32.3. Write a description of the injuries shown in the illustration. Look at A and B opposite and 32.2 above to help you. There is a laceration there on the left shoulder and an incisive one acute up approximately 6 cm in left above the left knee. Exercise 32.4. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. Number 2. He had several stabs. One is the abdomen from the knee. Number 3. He was knocked unconscious by a heavy blow to the head. Number 4. The wounds were only superficial and required no treatment. Exercise 33.1. Look at the conversation in a opposite and complete the notes about Mr. Jones. Use medical terms where possible. CO, frequency, and nocturia. For a 1 JRR. No, dysuria or hesitancy. Stream a little weaker. No incontinence apart from occasional dribbling. Exercise 33.2. Match the patient description of their symptoms 1 to 7 with the medical terms H, A to G. Look at A opposite to help you. Number 1. I have a pee every half hour or so. 2 letter B, frequency. Number 2, I get a scalding pain when it's past wear. Letter A, dysuria. Number 3, I have to get up several times to pass water at night. 2 letter E, nocturia. I have a rush to go to the toilet. 2 letter F, urgency. I have trouble getting started. 2 letter D, hesitancy. Number 6, I can hold my water. 2 letter G, incontinence. Number 7, I passed some blood in my urine. 2, letter C, hematuria. Exercise 33.3. Write the doctor's question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. There was a trace of blood gross. Excuse me. Possible questions. Frequency, how often is that? How often do you pass urine? Dysuria, do you get any burning or pain when you pass water? Nocturia, do you have get up at night? Hesitancy, do you have any trouble getting started? Incontinence, do you ever lose control of your bladder? Hematuria, have you ever passed blood in the urine? Urgency, do you have to rush hungry to get known to the toilet in time? Exercise 33.4. Describe the feeling of the laboratory report in words. Look at B opposite to help you. Blood plus, protein plus, cast nil. There was a trace of blood gross, proteinuria, and no cast. Exercise 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expression they use 1 to 4 expression with similar meanings from A opposite A to D. Right, Mr. Gold, because you've been having these head, headaches, headache, and going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, for may find your vision is a bit blurry. Teeth will wear off often about an hour. I need the right of rid of as much external light as possible. This means closing the bleeding. Now, in like you two look straining ahead at that clock. This take a few minutes and your eyes may feel a bit tight, so you can blink if you need to. I don't want you to look at me, look at the clock. Letter A. The examination is done with dimming lights. To letter number 1 to letter B. Letter B, a tropical drastic solution. Letter C, to eye dilation. Number D, physics of a target. Number 1 to letter B. Number 2 to letter C. Number 3 to letter A. And number 4 to letter D. Exercise 34.2. Complete the instruction. Look at B opposite to help you. Number 1. wrap the cuff around the patient's upper arm. Number 2, place the diaphragm over the area of the brachial artery. Raise the patient arm so that the brachial artery is at the same height as the hair. Close the valve on the pump. Pump up the pressure to at least 150 mmHg, millimeter of mercury. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. The first zone your head in the flow of blood through the brachial artery. The valve on the gauge at the point is the systolic blood pressure. Continue listening while you slowly deflate the cuff. The discharge blood pressure is measured while the zone completely disperses. Exercise 34.3. Complete the text, look at the opposite to help you. Phlebotomists are specially trained in sucking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a first, or a thrombus may be amplified on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent bruising the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory where a full blood, a cone or other investigation will be carried out. Thank you.